I'm going to discuss cranial-cruciate ligament tears in the young dog. In regards to stifle anatomy, we have the femur bone on top, we have the tibia bone. The tibia and femur bones are held together by a series of ligaments, including the cranial-cruciate ligament, the caudal cruciate ligament. We have these pads here called the menisci, the meniscal cartilages. On the inner side here, or medial side, we have the medial meniscus. On the outer side of the knee, the lateral meniscus. This is a side view x-ray showing the knee. We have the femur bone, the tibia bone. The top of the tibia bone is sloped downhill. And as a result, because of that, the femur bone, which is resting on that slope, inherently wants to slide down the hill, but what's preventing it from sliding down the hill is the cranial-cruciate ligament. Just like the wagon situation here, which we have the wagon on a slope, it is held up that slope or up the hill by this rope. You cut the rope, the wagon's going to go down the hill. Just the same here. The ligament tears and the femur bone will slide down that slope. The other thing we can have as an issue, as illustrated by this yellow wedge, is tearing of the meniscus. When the femur bone, represented by this wagon, goes down the hill, it can jump on the back part of the meniscal pole and cut a cleft into it, and then we have a meniscal tear. This shows, again, the medial meniscus here along the dotted line is where we typically see the tears of the meniscus. When we have a tear of the meniscus, as shown here, we have this portion, which is like a band that can pop back and forth under the condyle of the femur. With time, it will rub the cartilage off of the bones. So that does need to be addressed if that is the case at the time of surgery. The diagnosis of a cranial-cruciate ligament tear usually is pretty obvious. This dog has a lot of instability, indicating that there is a full tear of the ligament. In young dogs, we don't use our traditional TPLO or tibial plateau leveling osteotomy surgery because these dogs have growth plates. And growth plates is where the bone is going to grow from. So we have another procedure that can be used, but the timing is critical. This surgery is called the dynamic tibial plateau leveling procedure. And the reason it's called dynamic is that the tibial plateau will flatten or level as time goes on. And that's important for creating a stable environment in that knee when the cruciate ligament is ruptured. Candidacy for this is critical. Age is very, very important. These dogs need to be roughly 5 months, 2 weeks of age. If you have a giant breed dog, we might wait 5 months, 3 weeks. But generally, for a lab-sized dog, it's 5 months, 2 weeks gives us a really good results. These dogs can have either a partial or a complete tear, and we typically do these in medium to large breed dogs. I've only done it in large breed dogs to date. So let's have a look at the immature knee. These blue lines I've drawn on this model indicates the location of the growth plates. And so there is an ossification center here, the tibial crest, and then we have this portion right here called the tibial plateau epiphysis. And this is what we are going to change in order to create the flattening. And I'm going to show you that in a moment here. But as time goes on, the body is going to allow those bones to grow. And if we modify the growth a little bit, it will flatten the plateau. So as you can see, what we've done here is place a screw in the front of this portion of the bone through the epiphysis is what we call it. And as a result, this growth plate is going to be closed in the front of this tibial plateau, but the back portion of it will continue to grow. And as it grows, this back portion will flatten. And this is what we have pre-surgically. And then with time, over a couple months, it will flatten out. By the time the dog is about 10 months of age, we're really not going to get much more growth. So over about 2 or 3 months is where we will be seeing that flattening of the plateau. This is an example that I did recently, in which you can see the placement of the screw right here. We go just behind this growth plate, and again, this growth plate right here is going to be closed in the front of the plateau, but the rest of it does not close down, and as a result, it will flatten the plateau as this part grows and this part does not grow. And this is what it looks like from a front view. You can see the screw placed here. We have to make sure that it is dead on center of that tibia bone. That's critical, because if it is offset, then we will have the bone grow in a twisted fashion. So it's very critical that it is placed right in the center here of that tibia. We use intraoperative radiography to determine where exactly the ideal position is, and it enables us to get as good of a result as possible by using the intraoperative radiography. We utilize this medication to numb up the incision. It is a local anesthetic called Nocita. It lasts for 3 days, and it provides very good pain relief of the surgical site. Generally, we perform this surgery with a very small incision, roughly a couple centimeters, just enough to get in there and expose that area. Here's a case example, dog that had a 26-degree slope pre-surgical. This is immediately after the surgery. Screw is placed here, and here we are 4 months later, and our final result is a tibial plateau of 4 degrees, which is very, very good. So what happens after we have created the leveling of the plateau is a stable environment of that knee, and as a result, the lameness does resolve. Prior to surgery, we had the slope, the wagon representing the femur bone is now in the post-surgical state of flattened surface, thus femur bone, which is sitting on that flattened surface, doesn't have the forces acting upon it to slide out of place. Complications of this procedure may include imperfect placement of the screw. The surgeons who perform this are going to utilize intraoperative radiography to get as perfect as possibly can be with placement of the screw. But if it is set off kilter onto one side or the other, we will have twisting of the leg outward or inward. Overcorrection of the tibia is a possibility. We typically have not seen this to be the case. Undercorrection happens when the cases are done too late in life. So if you get a dog in that's about 6 months of age, 7 months, likely you're not going to have a positive result with that. And these guys will have continued positive thrust or instability of the knee and persistent lameness. These dogs, if they're not restricted while they're healing, could develop a meniscal tear if they have a complete tear of that cruciate ligament. Infection's another potential complication, but that is a very low possibility, as the surgery is relatively quick. Sterile technique is used. The technique does provide good results in the immature animal. Very meticulous technique is essential in placement of the screw. Quick healing is seen, and usually by about 2 to 3 months that lameness has resolved. So what do we see? They usually are walking on the leg within a day or two after surgery. By 2 weeks, moderate weight bearing. 2 months minimal lameness, 3-4 months, then the lameness usually typically is gone.